Hi, everyone. My name is Kristen Mason, and I am a director with Casey Women's Ministry. And I am so honored and excited to be joined today by Charity Bean. She is a doula with Doula Bean, and she is going to graciously talk to us today about humanizing clients in the birth space.
Absolutely. Thank you for the introduction. My name is Charity Bean, better known as Doula Bean. I'm the owner and operator of Doula Bean Maternal Care, LLC, here in Belleville, Illinois. I am a full spectrum doula, but I specialize in hospital childbirth as well as postpartum care. With my services, I do offer childbirth education in a 5-part series, all the way down from beginning of pregnancy to newborn care, as well as I do mom groups, as I call them, mom support groups. Moms Need Love Too is the title. I also do father groups, which is Fathers Matter. These groups are centered around Black families to let them know, because of life and how things are going and generational curses and things we're trying to break, so that we have a space to just be people of color and to vent freely about issues we may have, everything from work to children, relationships, things of that nature. As well as I am a student nurse at Kaskaskia College. I will be graduating and becoming a labor nurse in May of 2023. And I plan to go on and become a midwife.
Wow, that's amazing. Those wonderful services that you provide and spaces for people who definitely need them and have limited access to those spaces. Yes. So that's some amazing, amazing work.
Thank you. Thank you very much.
So humanizing clients in the birth space is such a large topic. And yes, I want to emphasize that this training conversation is to start. We're trying to get around the you don't know what you don't know problem of teaching ourselves, of continuing to grow past doula certifications, which perfectly honestly aren't always fantastic at covering all of the things that they need to with diversity and inclusion. So I'm really excited to start kind of covering this topic. What do you see a lot of in hospitals where you're kind of seeing some dehumanization of your clients?
With the dehumanization, I think people are, especially birth in general, birth is becoming more looked at, or the way it started once it got to the hospital, as I call it like McDonaldized, franchise, instead of just centered on the care, because labor and childbirth is not a race, it's a marathon. This takes time. And so because of the way healthcare is set up and because things are so focused on big business, it becomes more so, hey, get them in, get them birthed, ship them out, and it's very sad to see that, because the care that's needed, even in the prenatal period of going to the doctors and things of that nature, they don't always have the time to sit with you and discuss, hey, what's going on with your pregnancy? And a lot of times, a lot of people, we don't know what to ask, even at those moments, like questions and get a little further. And we're so used to just, oh, okay, well, the doctor said I'm fine, that's okay. Or even if you do think of a question, by the time you think of it, you've gone home. So it's like, hey, I want people to be seen more as a person, because I don't care how similar things are. Like, this person has a Pitocin induction, or this person is getting this. Everybody's labor, everybody's pregnancy is different. It doesn't matter how many similarities we have, everybody is different. Everything is perceived differently by that person. So more so acknowledging people, instead of it being so much like, again, like I said, like the McDonald's, like the franchise, where it's like, serve this many people, just get it done and get them out. And more so getting back to the love, the care, the comfort, the things that are truly needed to have better birth outcomes.
Yeah, I agree with everything that you just said. That is definitely, I love that term for it. It really does. It is an issue. Something I've noticed a lot of is, having medical staff that don't even know my clients by their name. They walk in and they just blanket call them mama from the time that they come in, and, mama, daddy, or I get called doula if I get, referred to at all. and just feeling that disconnect of lack of humanization between the medical staff and my clients. Do you have any tricks that you kind of use to kind of help, or a process to kind of help humanize your clients?
Absolutely. And speaking of which, so also I am a healthcare worker. I've been in the healthcare field for 13, I think, years now. And I work in a the birthing unit at a hospital. And so becoming a doula and things kind of opened my eyes to both like broads of the spectrum. So I know on this side of the door as well as seeing that side of the door. So do I agree? Yeah. And I know I do it sometimes. It's like when you don't want to mess something up, or maybe I didn't exactly. So I'm like, hey, mom, okay, is this dad? You know, in the midst of that, I'm not going to continue that throughout the process. Like, of course, I want to learn your name, you know, hey, and so can you tell me your name? You know, these are things that we're taught the basics in school. Also remembering that once you get to the hospital, you've never seen the staff unless you've been a frequent flyer, as we call it, like coming through issues or things. And we get to know some people, you know, we do. They come in for, you know, different services, maybe NSTs or, you know, a ROGAM shot, or even maybe some concerns where we had to monitor you. So some people we do get to know, but for most people, especially like a first timer, generally, we've never seen them before. So when they come in, a lot of people do that. But me personally, I like to, of course, you know, make sure, obviously, you got to make sure you got the right person. So learn their names.
Right.
And, especially acknowledge everybody in the room. Now, if I go back into my doula stance from that standpoint, you know, once the nurse comes in or the provider, whomever, I usually stand up, I introduce myself. My clients will do it for me. Hey, this is Charity. This is my doula, which they generally let them know ahead of time I'm coming. So they kind of know who I am. But once I come in, I'm literally, you know, pre-COVID, but I still reach out just in case, handshake. I'm like, hi, I'm Charity. You know, I'm the doula here. These are my clients. Obviously, you know, just introducing myself, letting them know, you know, hey, I'm here to help. Because the big thing, especially in the doula role, as I let people know, no, I don't work for the provider. I work for my client, but I'm here as a part of the birth team. So being acknowledged and respected. And also with that work, showing my knowledge, like I'm just not sitting in the room, you know, twiddling my thumbs. You know, I'm here to do work, and we're going to get some work done and have the best birth outcome possible.
Yeah. So when you're approaching this from the medical side, what do you think works better for you for forming that relationship with a, you know, in that case, I think they would be your patient, not a client. So with medical side, with your patient, what tends to work for you for forming that relationship?
I treat everybody like family. I come in, I'm myself, you know, a lot of people, and I approach it kind of, you know, you fill out the room and things, but I generally approach it with humor, you know, and that, you know, I come in like, hey, how you doing? So what you doing here today? You know, what's going on? Are we? Is that right? Okay. You know, things of that to lighten it, you know, because some people, especially those I've met you before, so you may come in fearful, you know, things of that nature. You know, what if the office just sent you over? Oh, this is how I get monitored high blood pressures. First thing I'm doing after, you know, I got your name. Hey, sweetie, guess what I need you to do me a favor? Calm down. Let them know, like, you know, hey, it's okay. We don't panic until we need to panic. So right now, what I need you to do is calm down and get yourself in a good space. This way, we can go ahead and try to get you treated. I don't want you to have an abnormal blood pressure reading. Let's say, you know, I literally will triage and start from the beginning. You know, I'm like, okay, do me a favor. Tell me what you did this morning. And, you know, like, what you mean? I'm like, how did your morning go? Were you rushing to get your other kids ready? Did you have a disagreement? Did your mom or someone upset you? Did your job upset you? You know, finding out the little things. Were you rushing to get to the doctor's office? Did you rush in? You know, like those simple things that you don't even really think about. I need to backpedal. And if you say the day was regular, I want to backpedal a little further in the week, because sometimes things could have happened the week before or earlier the week, and your body's just now processing these things. So I want to know, tell me about your last 24, 48 hours. Heck, tell me about your week prior. What's been going on with you? Let's try to see the person as a whole, holistically. Tell me how you truly feel and how you feeling about this pregnancy.
Awesome. So as a doula, trying to instigate that conversation could be something that we could do to kind of help humanizing the client if we have you know, and there's all kinds of reasons that exist for
Absolutely.
medical staff not necessarily humanizing their patients. And that's something that if you don't know about this, you need to learn about it. Horizontal violence in hospitals. If you don't have empathy and understanding for medical staff and you're demonizing all medical staff, you're not doing your job. That's one thing I would highly encourage you to learn more about. That's something that I hope to cover in this series eventually.
Absolutely.
Incredibly important. There is a lot of pressure on medical staff, which I'm sure you could talk about all day. No,
oh my gosh,
than I do. I just know the trainings that I've had, and from having so many family members that are nurses, and they come home in physical pain after every shift. It's just in the mental duration that some of them go through from different policies and from different other people who are acting their trauma upon them as nurses, and just they just have really hard jobs in general. Understanding where they're coming from, I think, would be a good place.
It is. We need to bridge that gap. I feel like a lot of things that happen with people in general, everybody, like you're saying, like birth traumas come from like lack of understanding and perception of things. Because I could say something, it happens so much, even my doula, or even when I'm just being, you know, Charity, the student nurse. And it happens so much to where the doctor could literally say the same thing I said, but the way the doctor said it may have, you know, made that person put up a wall or offended them in some way, shape, or form. But if I come in my delivery of it, because maybe I have more of a calming voice, you know, maybe especially when it's, I mean, especially with other Black women, you know, when I come in, it's like when you're surrounded in a world where it's like, okay, it's mostly white women. It doesn't matter if she said it in the nicest voice ever. We're automatically, due to the history of trauma in the medical field, we're on edge, we're nervous, we're terrified. You know, having me come in and literally saying the exact same thing that person said, because there may be, like you said, that bridge between where you can't maybe get to that person, but I come in and say the same thing, like, sweetheart, I need you to start drinking more water. You're going to have to do these things. This is where I got to have you hold your accountability. And, you know, again, it's just the delivery of things and understanding each other, because we also need to understand our patients and understand, yes, we are here for them. And also our patients understanding us, because I think a lot of people really don't understand childbirth and how serious this can be. Is it a full-time run the labor unit? Doctors generally, we're just calling, or they're coming over when it's time to deliver. And that's a lot of pressure on you, because you know, you have to, you're the, you know, the captain of the ship at the moment. So that's a lot of pressure. Then you have things where, as I tell people, honest to God's truth, the world is short-staffed. So if you think Popeyes and McDonald's are short-staffed, imagine what we go through. I'm just telling the truth, you know. So it's like we're trying, it gets to the point where and it hurts a lot of really good nurses, where it's like you can darn near only do the minimum, which is keep people alive and do the basics, because it's more of you guys than it is of us. And we're just trying so hard, you know, and it's like we're working skeleton and bones. And of course, I have to come after scrambling at this desk, something going on. I have to, hi, how you doing? You know, come in, let alone like in this pandemic right now, you have people whose parents have passed from this. They're dealing with a lot, or, you know, our children are in school too. So what you're facing, remember, we're human and we're facing it too. So I bridging that gap between where everybody truly understands each other and really understands each other's role. And again, everybody kind of leaving their biases and things at the door and trying our best to make this a better place and a safer space. But I mean, there's never an excuse to be rude. I will never excuse anybody being rude to someone, whether staff being rude to patient being rude to staff. There's no excuse. But also just that understanding that we are all human at the end of the day.
Yeah. And I think when I'm trying to come to a place where I'm feeling that a client is being dehumanized, that's one of the first things that comes to my brain is, I wonder what happened to this nurse right before she came in here. I wonder what is happening in another patient's room that has her this stressed out, or what happened at a labor that was similar to this that has traumatized this nurse that now she's bringing into here. And where can I come from that allows this nurse the space to humanize my client again? they want to do as good as service as they can, coming from a place of expecting that they're doing the best that they possibly can, and then open it to where they have that ability. What do you find like works really well for kind of setting that stage in a birth room for them to be able to do that? Like a safe place for the medical staff?
I would say, and honestly, it's not even just because that's the hospital that I actually work for, where majority of my clients go. I've been to multiple, like in St. Louis, Mercy, I've been to Big Barns, things of that nature. Once they come in and they kind of, feel me out and they actually see me doing the work and see me, keeping my patient up, doing things like going to ask for water, I communicate with the staff, not so much overstepping, because of course I give my client the option to, obviously to speak for themselves, but something that is coming out, making sure their water stays refilled. Like, I'm like, hey, just show me where the water area is. If it's somewhere I'm allowed to go, I'll just go get it myself. Those, just the simple things. I tidy up the rooms, just things like that. And again, after building that trust, and like, they'll see us walking, they'll see, or when the nurse pops in, I'm like, hey, the monitor maybe moved a little bit. You want to come and adjust it? Just them seeing me provide the comfort for my client, and truly being in that space, like I said, being a part of that birth team, because that's taking a lot off of her. So the fact that that nurse may have 2 other patients, like, you just don't know, she may have that laboring patient. They may be short staffed. Now somebody came in and triage, and in between that time, she's trying to make sure she's watching the monitor, make sure she's helping this person, or, honestly, just speaking on life happening and being in that situation to where in this hospital, if something happened, like a loss or something turned emergent just that fast, and I understand when although I'm in the room, if I hear that stampede run, something's going on somewhere. And knowing that something more urgent could be happening over here, and how that has made me feel at work, where I've had to process maybe somebody having a loss or getting even close to it, or rushing, it's petrifying. And, you don't have always that time to gather yourself and come back. By the time I'm done trying to wipe my tears, I'm back in somebody else's room and I'm trying to smile. And I just had a client who may have just had a loss, and, but again, it's like the McDonald's, we're short staffed, you don't have enough, you got to go over here. And it's not that because in this unit, you can never really be desensitized. If you are ever desensitized working in labor and delivery, you need to find something else to do. Yeah. Because you should always have that empathy and that heart for these families. So it's just that, like I said, just being able to process, and like I said, being able to say I've been on both sides of the spectrum. I'm here, I'm as a doula, and I'm also here. I understand what's going on with the medical staff. So again, just being that help and showing, my knowledge, working with them, being polite, asking for little things like, hey, can we get a birthing ball in here? We're going to do some walking, let her know so she doesn't come in panicking, thinking something's going on. Hey, just so you know, she's on the ball for a little bit. We're going to try this if the monitor's looking a little wacky, that nature. But again, just communication and again, taking control of the space and that help.
Yeah, doing the work, showing that you're part of the team by actually being a part of the team.
Exactly.
Modeling the behavior that you want to see. I've found that if I have someone who they've just been trained to take control of the situation, so they're not asking for permission before they're doing things. Well, they probably were trained to do it that way, and they've probably not experienced a lot of being told to ask permission before touching one of their patients, or asking their permission before, going in to do a cervical check, just saying, hey, I'm going to check your cervix right now. And modeling the behavior can change that a lot.
I find that quite odd because, again, as a nursing student, these are nursing 101 things. Those things come with behavior and always being in a rush and being there so long. There is no nursing 101. Those are literally, and I mean, that's the basics. That's no different than like CNA. I have to ask permission before I do anything to anyone. It doesn't, it's something as simple as raising up a cover. Do you mind if I touch you? Is it okay if I do this? Giving permission before you do something. And that does happen a lot of times. Providers will come in and say, so this is what we're going to do, da, da, da. And it's like, okay, I think you want to reword that. Like, this is what our policy is. This is how we usually do things. Just letting anyone to know how this is so it generally goes. Like, are you okay with that? It's something as simple as ending it with, is that okay with you? Do you understand? And from there, giving that person the option to process and say, okay. Now, in an emergent situation, I totally get it. In emergencies, you only got
we gotta go.
So you got to do what you got to do. But even in emergent situations, not been the person in the emergent situation, while everybody else is buzzing around me, doing everything super fast, I am still talking to that client or that patient like, I need you to focus on me. I want you to understand. So this is what is going to happen right now, because the baby has had too many decelerations. Unfortunately, now, for the safety of you and the baby, we're going to have to go to the back. I know it's a lot to process. I just need you to trust me. Keep your eyes on me. Just stay focused. The whole time, everybody's doing around you. But what kind of panic would I send her in if everybody's like, you got to go now? You know, I see all this going on, and I literally say, don't worry about them. I want you to focus on me. You know, even as a nurse or even as the doula, just focus on me. You know, and keeping that person as calm as possible during those type of situations. I feel like even in an emergency situation, I can say those things just that fast and still get everything done. But I'm still letting that person know, hey, I'm here. Don't lose focus. Stay with me. That's just how you do it. And I mean, again, people just get in their habits, and that issue comes.
Yeah. And constantly, you know, seeing them as a person who has the right to process what's happening to them, has the right to, you know, deny access to touching them if they don't want you touching them. And just because they're in labor doesn't mean that they lose their autonomy as, you know, an adult of sound mind.
What if they have trauma? I've had someone before I realized, you know, even though it wasn't, excuse me, I'm so sorry. Even though that pregnancy was not a result of rape, that young lady was raped in high school. And so when, you know, we went to the point of something as simple as even getting a check, I guess it just took her back there. And it took for me to be the one to realize it. And I'm like, hold on, time out, pause. You know, your reaction, I mean, the shaking, the shivering, the nervousness, I'm like, you have trauma. What happened? Tell me what happened to you. Because then I just met her. And of course, the comfort, she's like, well, you know, I was raped at this age and things of that nature. So it was like, whoa, you know, so now I know we have to proceed with a different type of caution with her. But you have some who'll say, well, she didn't get raped to have this baby. So what, you know what I'm saying? Like, we finna do this and we finna check, you know, and I'm gonna check you. No, you don't have to. You also have the right to tell the person if they're not compliant with what you saying you need to do to make sure that she's okay. It's something as simple as explaining to them, sweetheart, I understand. I get what you're going through. If you are not going to allow us the ability to care for you, to take care of you, I have to sign this form that says AMA, and I'm going to have to let you go home, babe, because there's nothing else I can do for you further, but I understand. You know what I'm saying? Just something that simple, and give them a moment to process it. If they do decide, okay, let's try, be patient, work with them. Biggest key is patience. And if at the end of the day, you know, that person still says no, it's like, I understand, sweetheart, but this is what we have to do. And that's how you cover yourself. And that's also respecting a person and, like I said, protecting you from any harm or any backlash.
Right. So as a doula, if you're in a birth space where what you just described is not what's happening, is there a way that we can, within our scope, kind of steer things more in a direction where our clients regain their autonomy?
You can say things like, you know, especially if I saw my client, they were like frightened, like they like, hey, excuse me, guys. Can we take our time? Can we be a little patient here? Can we give her a moment? You know, just type of redirections. And I mean, I had a moment with that one because of that situation. It's more so, and I was not in doula role. I was actually in, you know, healthcare role where it's like, I had to be the one to say, okay, you know what? Enough is enough. Sweetheart, we're going to just let you sign AMA. It's okay. I was the one that said, because nobody else was, you know, at the moment, it was about to become a traumatic situation. And the time out, we're done. You know, like, we're not going to cause her more harm. Sweetie, I do the best you can. So I don't know, as far as in the doula role, if I was at that moment, if that was me just crossing the line, or it was also me being an employee. But as far as you think, even in doula role, I probably would say the same thing. Hey, stop, we're done. And give them a chance from there. But somebody has to control the space in the room. So nothing wrong with, you know, trying to speak up for that person, especially if they're not able to speak up for themselves and say, let's stop. Let's for a moment. And if they don't agree with that, well, then what is the next step from here? Because if that's the case, then we need to do something else because this isn't working.
Yeah, referring back to them, stalling for time, asking questions like, what would happen if we did nothing?
Right.
That acronym, use your brain.
Yes, right. Like, okay, so what happens now? Nothing, those sort of things. It's like, I feel like people forget that, and I mean, I put myself in the position of being a provider, and that would literally have to be how I go. Okay, sweetie, I understand. But at this point, there's nothing more I can do if that's what happens in my scope, and say, hey, sweetie, it's okay. And also, even I would go as far as to refer that person to someone, like maybe even therapy or something, like, sweetie, you got some trauma you got to heal from. I need to go see this person. Maybe this can help you out as well. If I can't do nothing else, at least I can do is give you a referral,
Yep. I keep sticky notes in my purse all the time that has Moxa's number at the bottom. And I'll just write them a little note, hand them the sticky note, be like, and this is their contact information. If they've been through some kind of sexual trauma,
right.
They can talk to them after. It's hard when you don't find out about their sexual trauma until they're already giving birth. It's helpful if they can start working with the therapist before.
Yes, it would be so helpful.
That's
honestly, it's listed on my intake form. And again, it's not like I don't have the asterisk that says it's required on it, but I give you a space to talk about these things. And if they choose to answer, or if they want to ask me further questions about the question, then that is when I get into the spiel of understanding how, when you get to the point of labor, how that could affect you and possibly, lead to, you being tensed up, not being able to dilate, not being able to have this birth this way, leading to you probably having a higher risk cesarean, just, having the conversation with people. But it got to the point where I realized it needed to be a question on my intake form, and they didn't even have to give detail. But we need, even as doulas, we need to know that information, because if all of a sudden you're triggered and I don't know why, I just feel like it makes us look kind of inefficient in our job, as well as, I mean, I don't even expect them to always open up to the medical staff and tell them these things, or have it even listed in their prenatal. Yeah, it's not always listed. So, sometimes you just have to have that person that you feel like you can trust. And that's why I'm like, hey, we can talk about it. If you don't want to talk about it now, we'll get to it later. But has anything ever happened along these lines? And this
and it's so interesting with that, how if you know beforehand, you can see it coming and prevent it before it even happens. But that's because we have this privilege as doulas of being able to get to know our clients individually and stay in that one room and focus on that one person, which isn't going to be the story for medical staff. They quite simply cannot do that. It's something at New Birth Company, whenever I'm there, I'll always have a midwife say, man, I wish that I could just hang out in here like you do. But I have to go. I have charting I've got to do. I have other patients that I have to go visit. And, knowing about those kinds of things, preventing them from happening in the first place, is a really important job for doulas.
It is huge. And again, that's another reason why having a doula is such a benefit, even to the point where, you don't even know guaranteed if you're going to get that same. You may get so attached to one OB or a midwife or somebody, and then when you go into labor, it's not even a guarantee you're going to get them. You do the whole induction thing, and we'll talk about that another time. I'm not a fan of elective inductions, but if my clients choose to do it, okay, this is how we're going to work with it. Again, I don't make the decision for you. Do what you want, but I'm going to give you all the information to make an educated decision for you. Again, with that scenario, so that could cause, or what if it happens to be that day that it's one of the doctors that you just did not mesh well with on call, and it's like, but knowing you have that option of even saying early on that, if this person rubbed you wrong in the office, saying, I don't care what's going on, I don't want that provider to touch me or be a part of my birth. We're done, giving them that power, because a lot of people don't even know they have the option to say, hey, that person is a no for me,
Yep, exactly. Yeah, great. Do you have any continuing thoughts for humanization for clients in the birth space? Just some things that doulas need to, you need to know this before you go into a birth room for this topic.
Oh, absolutely. I always say, do not stop at just your training. Training gives you nothing but the basics, and that's okay, but you should continue to educate yourself, continue to go to advanced training Find doula mentors. It is important so you can learn this nature. Do not jump off the porch and get a high risk pregnancy. Make sure you start low and work your way up, because if you don't have the knowledge for these things, you're not ready for it. Don't let anyone make you feel incompetent in like the birthing space. So again, knowledge is power. You back yourself up with knowledge, follow up with those CEUs and things, and make sure when you do go to doula training, if you haven't had one, please have a culturally competent training, and make sure you receive ABAR training, especially if you're going to work with different races and different communities and different sexualities. If you have a bias towards anything, then I don't suggest you work with those families. You need to do this out of love and care, not just for money. So if you have something against same-sex marriages or couples, then you should politely refer them to someone else. You don't even have to tell them that that's why you're not taking them. You can politely say, I'm booked, and send them to someone else who is specializing in this care, so you don't ruin the experience for them. And same as if you take on a family of color or a Black woman, anything like that, and you're not a person of color, then I would honestly say just refer them to another Black woman so that they can possibly have that experience and be more of an understanding. And it sounds like a joke, but it's something so serious. If I can't talk to my doula or my OB and say something simple like, okay, and for some people, they're like, why is that important? But if I say something like, okay, I'm going to be about 37 weeks, and I think I want to get my hair braided before I go to have this baby, so I don't have to worry about my hair during the postpartum period. So if I say that and that person doesn't even understand or culturally understand why I'm doing this or what it means, something of that nature can advise me, then that's also a thing where it's like, okay, maybe sis, you need somebody else with you. But at the same time, it's not saying that you shouldn't take them 100%, but please be culturally competent and understand the pain and the trauma and things that have been built on the backs of Black women and Black families before you jump right out there and say, oh, I want to help and be this savior. That's not what that is, hon. We need people who understand and are truly here for the fight so that we can end the Black maternal mortality rate and end the mortality rate in general, because there's no reason for the United States to be number 37 out of all these nations. I think the Ukraine is beating us. No shade to the Ukraine, but I think it's this big that don't make no sense. I'm just saying.
It's embarrassing and it's awful.
It's very embarrassing.
And yeah, like you're saying, there's no reason for it. We have everything at our disposal to have the best mortality rate in the world, and we don't.
And that's ridiculous.
And it's ridiculous. And there's things that we can do as doulas to really help with that. There's so many humanizing things that we can do that will help our clients get treated appropriately in a birth space.
Absolutely.
I was taking a training with Moxa recently where they were talking about how when you have people of color that are giving birth in a birth space, a lot of times medical staff will minimize their pain. And then that's something that you have to be very aware of that can really cause high mortality for people of color. When they're starting to say, I am in this pain, people say, oh, you got this, or you're fine, or you're too late for pain meds or something along those lines, when they're actually not. And they would give it to a white person. Being aware of that, humanizing your client past where if you're working with a racist doctor or something along those lines, there's not much that you can do besides just ask your client if they would like to have a different doctor.
Speak out. Speak out. Yeah, you gotta go. And I try to empower my clients early on. I need to know, who is this provider? Who are you seeing? I need to know their history. I'm looking things up. Have we read? Not always saying, because a lot of times you get more negative reviews than you would a positive, because people love obviously a bad story. But however, this person got quite a few reviews, especially as being known for causing trauma in the Black community. Oh, baby, no, we got to let this person go. And I'm vocal about it so this person will not put their hands on Black bodies. And that is true. The sad part is this is just now probably coming out of medical books. And the reason that was even told that Black women or Black people of color even have a higher tolerance of pain is because of the experiments that were done on us during slavery. And you don't understand the mentality that you had to have just to survive. So for the 3 Black women whose bodies gynecological care was built on with no anesthesia, of course it's documented, the patient tolerated well. She had to go somewhere mentally just to survive. So most of us are built on survival and what is called a strong Black woman syndrome. So a lot of times we don't express our pain, or it may look like we're handling things well when inside we're probably actually breaking down. And just because I'm calm and I'm telling you my pain may be an 8 don't look at me or label us as like, oh, she must be a drug seeker or some of these things because her face or something doesn't match what you think my pain level should be. That's ridiculous. And know that where these things start because we're so used to not having a voice.
Yes. Yeah. And, you know, being aware that that kind of thing can happen was, you know, it changed my life for how the support that I give for sure. That's something that I look out for now whenever I'm in a birth space. If my client says that they are in pain, they're in pain, and it's time Absolutely. To do something about it. We recognize it. We do something about it immediately, especially if they're experiencing postpartum pain and then getting ignored for it. That's where a lot of maternal deaths happen, according to a couple of different trainings that I've taken.
It is. It's more so within that first year or, you know, right after childbirth or within the first year of something happening or leading to, you know, that birthing person. And that's the sad part because nobody wanted to hear you or nobody took you seriously, you know. It's horrible. Like Judge Hatchett's daughter-in-law who passed away, Kiara. And, you know, she was saying she was in pain from that cesarean. Was that cesarean? Yeah. I mean, this story goes so deep, but her urine catheter was full of blood. How can you not know that's an emergency? And then you're running telling people it's something that, you know, if whoever you're telling is blowing it off, ain't getting the nurses on time, and then they ain't getting the doctor on time, then you come in, now it's too late. And it's like, oops, you can't oops the loss of life.
Right.
So, you know, and that's just horrible. And again, like having our pain taken serious, and it's true. There are cases documented where Black women weren't receiving the same dosage of anesthesia.
Yes.
Epidural. Or now, and I don't know all hospitals are doing this, but there are things where, and it's not just this doesn't just affect Black women, this is just in general how I think this is awful. You know, some anesthesiologists are not working for that hospital, they're contracted. And so right now, if a person says they didn't want to do a COVID test, for example, they have the option to say, well, then you're going to have this baby with no pain medicine because I'm not going to perform the epidural on you without knowing your COVID status. And that is almost like a form of punishment because this person doesn't want to do this. And lots still don't have where, you know, some people have a spit test and stuff. And a lot of people are fearful of that. Like it was a young lady I heard about her case. She was traumatized from her job prior to that, working in like home health, not home health, like a nursing home. They nearly had to get swabbed like every day. And it caused her to have really bad nosebleeds at one point. And so, you know, whether it was being done right or wrong at the time, it was traumatizing for her. So she didn't want to do that. So when it came time to it, she's like, no, I don't want to do that. I don't want to do that. I'll just wear my mask or whatever. But not that's what anesthesia. And I mean, at the same time, they have the rights to protect themselves because they have to. I do get that. But when we're in this space, well, guess what? I can't say as a nurse, I'm not going to take care of her because she test. So why do you have the right to say, well, I won't perform this anesthesia and she could just labor in pain, you know? And it's like, that is absolutely ridiculous. But the sad part is they got the right to do so. And that is the problem, you know? So those are the type of things we're facing now with COVID.
Do you have any advice for doulas who might be experiencing something like that with a client, things that they can do to kind of help? Or is that something that's just completely out of our control?
Talking. Because even with that young lady, it wasn't so much that I was trying to even coerce her to do so. I just wanted to have the conversation because it took for me to have the conversation when she refused it. Again, it's something as simple as getting to the nitty gritty of what has led to us being here now. So it's for me to ask the question, I'm the one that found out, you know, that's what was happening and how she had all this nosebleed and things. And I'm like, well, that's why she refused. And I said, well, hun, you know, what if I told you it wouldn't go that way, you know? And I'm like, you know, giving her the tips and tricks, like if we tilt your head all the way back to here and do it really quick, I will hold your hand through it. Just because I didn't want her to have to, you know, be forced to go through something like that. But it's always a way of giving another option. And then how easy that was for me to talk to her and say, it's not going to go that way, you know, we do to help you through this process so we can make sure. And then also, you don't want to treat you like you have COVID to the point that because your status is unknown, where your baby is not in room with you anymore because they can't risk, you know, again, it's policies and procedures to everything. I always tell doulas, please call those hospitals, ask the questions, find out their policies at that time, prepared, tell your clients to call and ask those policies. And just so you're aware of how things are going right now during the pandemic. But it starts with knowing why we're here. Why do you not want to do this to me? Tell me. And then from there, once you find out why, see if there's a solution for us to help get through this point so that we can have the best outcome. And it's not saying that I want you to give up on your will or break anything. If you say no, I respect that. That is perfectly fine. I also want you to know that that's what they're trying to say they're going to do. And I hate that for you because it's as if it's a form of punishment. But if you trust me, I can get you through this process either way it goes,
Mm-hmm.
So
yeah, and that's great advice for all kinds of interventions and testing. If someone's wanting to go from external to internal monitoring and that is scaring them, anything that can, the medical staff don't have the right to force them and they're not going to, but if they don't do this, then there could be consequences.
Yeah, like the bullying. Mm-hmm. It's the bullying of it for me. So where you're like, well, if you don't do it, it's this, instead of just saying, hey, well, why not? And then just saying, okay, I understand, I respect your feelings. So because that's what you want to do, I gotta let you know this is what their decision is too, and explaining, unfortunately, I hate to say it this way, but they do have rights too, hun. So that is why we're going to be here. But I tell you what, I'll give you some time to think about it because it wasn't like it needed to be in a rush at that time anyway. But again, when you lay things out on the line, instead of trying to chastise, that's not your child. I'm not going to tell you you're my way or the highway and that's it. It's like, this is what options we have and this is what this could look like. And even delivering the same message of, hey, they may take the baby out the room, this, that, and other. I'm not going to deliver it to you as if I'm chastising, like, well, you may lose your baby's going to go out the room and we're not going to do this and we're not going to do that. It is so easier to just talk and say, hey, this is what our policies are. This is how this is working right now due to the pandemic. How do you feel? I have to inform you of these things. What would you like to do? You even got the option, especially if it's an induction, to say, well, I ain't coming here. I'm going to go somewhere else,
Yeah, turn it off. I'm leaving.
I'm out. That's it. So, again, it's all in communication, really. And again, as you said, the whole base of this conversation, seeing people as humans, understanding that everybody doesn't know or even understand the medical field or what is going on or what day and age we're in now, so that they can be informed and have that option to make the best decision for them and their family.
Awesome. So, thank you so much. This has been a really fantastic conversation. I really appreciate you taking the time out of your day to share your knowledge with us. This is such an important topic, and we really do need to take the time to educate ourselves past what, as you were saying, our basic training is. If somebody wants to learn more about this topic, do you have any resources that they could go to learn some more?
More topics about humanizing. So I would definitely say go to, even if whoever you may have trained with, look into others. Like I am a big fan of the National Doula Association. They have so many resources, so much information as far as like diversity training, humanizing, especially if you may not understand like same-sex couples, but you want to know more. You're not against it, so you're not offending anyone. Something simple as knowing that if this person wants to be called Michelle, just call them Michelle. Like, well, what do I call you? By their name. Something that basic. You don't say him or her. Hey, just say their name. Or things of that nature. So, and also like, for example, place like Jemima Birth Village in like Ferguson, Missouri, things of that nature where, people of non-color can receive ABAR training, which is anti-bias, anti-racism. And I recommend that not just for doulas, for medical staff, all medical staff, just to make sure you're understanding and we're breaking that, that cultural gap. So it's like, never knew that, those type of things to get education, book list of things, also, Evidence-Based Birth by Rebecca Beaker.
Yes, I love that training. I took that 2 years ago and it changed my perspective so much, which is so important. Yeah, awesome.
Totally amazing. So I would definitely recommend those three for sure. National Black Doula Association with Tracy Collins, Jemima Birth Village with Brittany True Kelman, who's a CDM here in Missouri, and as well as evidence-based and good stuff instead of just logging on YouTube and you just never know, these are factual. So, and continuing education. So those are awesome.
Great. Also, if you are in our area, where I'm based out of Kansas City Metro, every 6 months, Casey Women's Ministry hosts MOXA. and they talk about a lot of the things that we talked about today. So there's really good training to continue these conversations a little bit more in depth. And I'm really excited about those resources. I'm going to reach out to a few of those resources. I actually have not done them before. So thank you so much for sharing this with us.
Absolutely. They would love to talk to you. And I mean, I knew it, but it didn't dawn on me, KC. In Kansas City, Missouri, there is actually Aussie Village.
Uzazi Village is amazing.
Yes, Uzazi. Lord have mercy. She would kick my butt for not pronouncing it right. My apologies. But yes, another amazing resource right there in your hometown. So like many great resources. I love it. Thank you. I'm so happy. Thank you. I think we're freezing.
We are. There we go. Okay.
Am I back? Okay.
You started freezing as soon as you started talking about Uzazi Village.
Darn it, yes. Uzazi Village. Go to Uzazi Village.
There we go.
Diversity training. You want diversity training? You need to go. That's the mother. That's actually a sister village of Jamaica Village, which helped, I think Jamaica in Ferguson, Missouri. So yes.
Yeah. That's we absolutely love and support Uzazi Village. They have such an amazing message and outreach and such an important mission. That we're so grateful to have them in our area to be able to support so many people that need it and really bring that education and that safe space that is just so important, like you were talking about.
Mm-hmm. Very important. We just have to get back to making birth safe and sacred again, and just making sure no matter where people choose to birth, it is a safe place for them.
Yeah.
Families. Yep.
There it is. That's it right there. There's our
goal. That's it. That's the goal.
Well, thank you so much for joining me today. And I just really, really appreciate it and wish you all of the luck in your continued work. Sounds like you're doing some really awesome things in your area.
Why, thank you. Yes, I even have this is my second annual Doula community baby shower. It will be October the 10th in Fairview Heights. Oh, it is huge. I'm really big. I'm spreading the word on, as we say, get you a doula, sis, because, get you a doula. I don't care who it is, get a doula, get these resources and trying to change birth culture so that we can truly get to the part where we're empowering, educating, truly advocating and supporting one another and knowing how many doulas really exist. We're out here, it's a doula dating service, it's going to be a room full of the doulas and other resources to make better birth outcomes, such as like life insurance, credit, things of that nature people don't think of. We think of the glitz and glam, but what about setting this child and your family up for life? Saving the savings account. You put $1 in a week. By the time that child is 18 or decides to jump into the world at 21, you say, hey, here's a check for $10,000. I've been saving since I had you. Get on, things like that. I can't wait.
Well, great. Sending you all of the support. That's fantastic. Okay, awesome. Thank you so much for joining us today. I hope that you learned a lot, and go check out those resources. Continue to educate yourself. This is not a stopping point. This is a starting point, and we should never be done learning and continuing to expand our understanding of different cultures, of different perspectives, and making ourselves better doulas and better people.
Absolutely.
Thank you for joining us today.